Good evening, everyone. Myself Alan. Today we are going to discuss about the first pass metabolism. As we have already discussed in the route of administration video of pharmacology, that in the next video I will share about the first pass metabolism. Okay, so today we are going to learn about the first pass metabolism. So first we have to know the routes. We already know the routes, right? Orally we can give the drugs, IV we can give in intramuscularly, subcutaneously we can give the drugs. So suppose we are giving a drug orally, okay. This is stomach and this is small intestine. Okay, so we are giving 100 molecules of drug. Okay, so why we are giving the drugs? When we give the drug should do an action, right? We need any benefit by taking the drug. Okay, so the action might be decrease the heart rate, increase the heart rate, or whatever the disease, the action must do some work. Okay, so here we are giving 100 molecules of some drug. Okay, so it should go first, it should go to through stomach, then it should go to intestine. From intestine, where it will go? It will go to liver. Okay, how it will reach the liver? It will reach the liver by portal vein. So we can draw a liver here. Okay, so portal vein is here. Okay, so by portal vein it will reach the liver. Okay, so these 100 molecules are we are giving the 100 molecules. So out of 100, 10 molecules should excrete through fecus. Okay, so 10 molecules is already gone, and the remaining 90 molecules will reach the liver. So in liver, what liver will do? Liver will metabolize whatever the substances it already go through stomach. Stomach has hydrochloric acid. It will break down some of the substances, and like intestine it will absorb from liver, intestine, stomach, it will reach the liver, and in liver it will metabolize whatever the substance, it may be a drug, whatever it will metabolize. So after the metabolization happen, after metabolization what will happen? It will become 40. Okay, so the 40 molecules are already metabolized. So why liver is like 40 molecules is metabolized. Okay, and after that this we are giving drugs or medicine, we are taking medicines to reach the systemic circulation, then only it will give us the desired action. So only after metabolization this remaining 50 molecules only reach the systemic circulation. Okay, this is systemic circulation. Okay, so this happens, 90 becomes 40. This metabolization is called first pass metabolism. Okay, so 50 molecules are only reaching the systemic circulation, another 40 is metabolized. So this is happening in liver. Okay, so it is called hepatic first pass metabolism. Okay, so now we should understand some points also. That is, we gave 100 molecules. Okay, 50 molecules reached the systemic circulation. So 50 percentage is the what? 50 percentage is the percentage of dose which reach the liver. Sorry, which 50 percentage. This is called bioavailability. So bioavailability means bioavailability. Whatever the percentage or whatever the molecules which reach the systemic circulation for getting us the desired action is called bioavailability. It is called biologically available. How much dose is biologically available? It is called bioavailability. Here 50% of dose is biologically available for us for to produce any action, and if we are telling it in fraction, okay, it is 0.5. One molecule we are considering 0.5, 50% is 0.5. It is reaching the systemic circulation. Okay. So that's all about bioavailability. And what are the factors affecting bioavailability? We should know the factors. Okay. So what are the factors? One is absorption. Okay. If the absorption is low, bioavailability tends to low. Okay. Okay. Then what are the another factor? It might affect the bioavailability. Of course, it is first pass metabolism, because first pass metabolism is like cutting some percentage of drugs, like metabolizing is happening, and this liver is cutting some percentage of the money, or like if you are getting salary, some percentage is cutting as TDS tax, like that. Okay, so this first pass metabolism is kind of TDS, so liver is cutting some TDS, so balance only we are getting, so balance salary only we will get, like that. This bioavailability is after cutting the percentage by the liver, whatever we are getting, it is the bioavailability. So if the first pass metabolism is high, obviously this bioavailability will be less. So if first pass metabolism is low, obvious, right, it is bioavailability is high. So this is the factors affecting. And we have to know, if we are giving by a rectal route, it also has the first pass metabolism, but comparing to oral route has high first pass metabolism. Okay. And now we have to know, we already discussed routes of administration, right? So in this routes, oral route we have, right? In oral route, 5% to 100% is the bioavailability. Okay, so 5% to 100%. And in subcutaneous and IM routes is having 75% to 100%. And in IV, we are getting 100%. Why? Because we have to give the drug. Why we are giving drugs? It should reach the systemic circulation. But in the case of IV, we are directly injecting the drug or medicine to the systemic circulation through IV, the vein, right? So it is directly getting into the body. So it should have the 100% bioavailability. And in some cases, we are giving we have A drug and B drug. Okay, so the bioavailability of A drug is 70%, but if we combine with B drug, it became 80 to 90%. So what had happened here? Okay, so it is either this B drug increased the absorption. So obviously, if we increase the absorption, first pass metabolism will also increase. If we or it inhibit the or decrease the first pass metabolism. Okay, inhibit or decrease the first pass metabolism. So first pass metabolism is low, this bioavailability is high, and like that. Okay, so if it have become 50%, so it might decrease the absorption, or inhibit the absorption, or decrease the absorption, or increase the first pass metabolism. So the bioavailability of the drug is low. Okay, and you have to know a certain drug, nitroglycerin. Okay, this is used in acute attack of angina. Okay, attack of angina. And what this drug have 100% absorption. Okay, so what is 100 why it is having 100%, like we will discuss in a bit. Okay, stomach, what all. Okay, this is stomach. Okay, pardon me. So we are having stomach here. So this 100 drug we are giving 100 molecules, so it is reaching the liver. Oh, where is liver? Okay, through portal vein. How much it is reaching? 100 is reaching, but only one percentage or one molecule is only reaching the systemic circulation. What happened to balance? It is 90 molecules are metabolized in liver. So first pass metabolism is reducing the 100% to 90%. So 99% is TDS is cut by liver. So liver is taking the 99, the metabolization happens, and liver is taking the 99%, and only one molecule is reaching the systemic circulation. So we can say it have high first pass metabolism and high absorption. So we can say if if a certain drug is having 100% absorption, it doesn't mean it will reach the systemic circulation. Okay, so we have to calculate the first pass metabolism also. We have to take into account. Okay, and we have to like that nitroglycerin, lignocaine, and propranolol. Okay, so these two also having 100% absorption. Okay, remember these drugs. And we have to discuss something further on nitroglycerin. Okay, what it is. So what's the preferred route of administration of nitroglycerin? Okay, it is sublingual. What is sublingual? Sub means under, lingual means tongue. So under the tongue we will keep this drug, nitroglycerin. So here wait a minute. Okay, so here there is a vein. It is called sublingual vein. Okay, so if we give what action we need? We need the drug to reach systemic circulation. So there is a sublingual vein. If we give the drug sublingually, it will directly reach the systemic circulation without going through the esophagus, stomach, and intestine. It will directly reach the systemic circulation. So we are cutting the first pass metabolism, or we are cutting the TDS by the liver. So we will get the desired action very fast, because the process will take around 40 minutes. If it is going through the esophagus, stomach, all those things, it will take time, but we are directly getting. So then you can ask, why don't we give it through IV? Obviously we can give it through IV, but why we are not giving through through IV instead of IV? We are giving sublingually. Sublingually is the preferred route in acute attack of angina. We are giving nitroglycerin in that case, and I will discuss it soon. Okay, so what are the advantages? So if we speak about advantages, we will know why we are not giving IV. Okay, so it have no first pass metabolism, or it is having negligible amount of first pass metabolism. So, and another thing is, if we are giving into the tongue and giving under the tongue, we will get the action very fast, comparing to we can't also compare, because it will take 40 minutes, but it will take only 3 seconds if we are giving through sublingually. Okay, so the very fast acting. So if it is fast acting, we are getting the action very fast. It means it can be used in emergencies. Okay, and why we are not giving IV is like, if the patient may be like, if he is working in home or working in office, suddenly this acute attack of angina happens, and he can administer this drug by himself. Self administration is possible. Okay, so in case of IV, we required any expert or expertise to put IV, but in case of sublingually, we can just put, the patient can himself also put the medicine. So that's why we are preferring sublingual route. And another advantage is also, if for example, here I am using, okay, we are giving 10 mg. So it is just an example. Okay, so 10 mg we are giving, and if the 5 mg only we need to take this angina acute attack stops, the pain, chest pain will stop. Okay, but if we are giving 10 mg through oral route, okay, so we can stop the action after 5 mg only need to stop the chest pain, but another 5 also we are giving extra. So in case of orally, if once we take, we can stop the action. It will go, it will full drug will go. But if we are taking sublingually, if we get the desired action, we can just spit it out, or we can just swallow the medicine. Why? The first pass metabolism will keep all the remaining drugs and it won't absorb into blood. So we are not getting the extra dose. We can terminate the action. That's why it is preferred route. Okay, terminate action. Okay, terminate action. So that's about first pass metabolism, bioavailability, and this drug nitroglycerin. I hope you enjoyed this video and subscribe for more videos. We will keep uploading pharmacology series, all medical related videos in this channel. Okay, thank you for watching. Bye.